Hello, everyone, and welcome to Thrive Conversations, where we delve into real life stories of transformation and resilience concerning our mental health and personal development. Today, my guest is Mrs. Oluwatoyin Ogunkomi, and she is a clinical psychologist. We're going to be talking about how addiction is a disability. So, welcome, Mrs. Toyin. It's so good to see you here today.
Thank you so much. You're really doing a great job.
Thank you. It's something that I really love to do. When it comes to addiction, addiction makes me come alive. Some people it might sound very weird when people hear you say addiction makes you come alive, but topics and conversations surrounding our mental health and addictions really make me come alive because there's that phrase that says that there is no health without mental health, and it's so true. And this is why I'm talking about mental health and addiction as a disability. Because some people will think that it's not something you can tangibly hold. Because, when a person is physically ill, that's when you say, oh, the person has fallen apart. But when a person has a mental health issue, you can't necessarily see any physical signs. So, why would you say that addiction is actually a disability?
Okay, so I guess I'll first of all start by defining or talking about what addiction
Addiction
really
is,
is.
yeah.
When it comes to addiction, a lot of people don't understand that addiction is a disease. They see addiction as a moral failure.
Absolutely.
And part of the things I tell people is that see, the use of drug might be a moral failure, but the addiction
Itself.
is a disease. So what really is addiction? So addiction is a chronic relapsing brain disorder
Yeah.
that is characterized with compulsive use, the compulsive urge to use the substance or to do the behavior. So addiction is not just about substance or drugs. Addiction could also be in terms of behavior.
Yes.
We have some people that are addicted to gambling.
Yes.
Some people are addicted to sex. Some people are addicted to shopping. So addiction is not just all about substance. It's also about behavior and substance. So it's a chronic brain relapsing disease that is characterized with the compulsion to keep using, despite the fact that you know that this thing I'm doing is detrimental to my health or is detrimental to my relationship with other people. So that's what addiction is. So back to your question, if addiction is a disability, I'll say yes. Like I said when I started, addiction is a disease. And like other diseases that could impair you from either working or doing things to make your life function or to function properly or to function optimally,
Yes.
would say addiction is a disability. So how is it a disability? It affects the way you think. It affects the way your emotion, your mood. It also affects your behavior. It affects you from relating to people in terms of your relationship. It affects you from carrying out your day to day function. Your ability to either learn, your ability to work is affected. So that's why addiction is a disability.
Disability. So you see, there's something that people will say. It's depression is a word that is loosely thrown
Oh yeah.
around. Someone just like, oh my God, I'm so depressed. I'm so depressed. I want you to just shed a bit of light on that depression and so that people that use it loosely will understand that they may not even be depressed after all. Just shed a bit of light and then compare depression to how it actually can be a disability itself, because I know that there is a comparison about depression and how it affects our daily function. So can you just shed a bit of light on that as well?
Okay, so when we talk about depression, some people might term it as low mood. Some people will call it depression. So when you're feeling sad, we all feel sad, which is normal. When something has happened, something has affected either you or affected someone around you, or you've lost something, you will feel sad about it.
Absolutely.
That is normal. Now, when we say you are suffering from depression or someone has depression, it simply means the person has low mood. The person is not able to things the person was interested in doing in the past. Person is no longer interested in doing those things. Person is feeling sad all the time. The person is the person it maybe cries. The person cries. The person, that there's different criteria that would determine if the person is depressed. However, when person go through all those things, and those things have been going on consistently for minimum of 2 weeks, that's when the person can be clinically diagnosed as having depression.
Fantastic.
So when we are sad, oh, you're sad today,
Fantastic.
you're tired today, you're feeling low, you have low mood today, that doesn't characterize or that can be diagnosed as depression. But
Hey.
when you feel sad, you cry, you lose interest in things you used to be interested in, when those things that used to make you excited no longer gets you excited, you're not interacting with people, you're isolating yourself in the room, all these things are quite a lot, about 9 criteria, right? But when you've gone through this, you've experienced all these things consistently, that's the word, consistently, for a minimum of 2 weeks, then we can say you can be clinically diagnosed as having depression. But you still need to see a therapist, you still need to go to the hospital
For assessments to be
proper
done.
assessment to be done.
Fantastic.
Yeah.
I love it. I really, really love it. So this is something that I really needed most people to know and understand, because people loosely just say, "Oh, I'm so depressed," or "I'm so depressed." I know someone that said she had she lost some money, and then she didn't want to come out of her house. In fact, she didn't want to get out of bed, and so she shut down all the curtains in the house. She didn't want to see light. She just didn't want to. If you put on the light, she was going to just, scream her head off. And it happened for close to 2 weeks. Can I actually say that person is also depressed?
Yes, that person could. So that could be a sign of depression. But like I said, proper assessment needs to be done.
What about people that, sorry to cut you. What about people that don't have anything? Because this one you can trace it to, oh, it was because she lost some money. Are there cases like that?
Okay, so when we talk about mental illness in general, there are actually some predisposing factors that can make someone experience a mental disorder. Or so, for example, genetics. Some people are genetically predisposed to having a mental disorder. What do I mean by that? It's in their lineage. Somebody in their family, either the parents.
Wow.
Then also we have what we know as biological factors, such as the neurotransmitters in the brain. There's an imbalance in the hormones in the brain. So, for example, when we talk about depression, the level of serotonin in the brain has reduced. That is biologically. We can't say it's because of something. It's simply because the biological function of the brain, the serotonin has reduced. That's why someone might have depression. And you're wondering, but nothing happened to me. I was not raped. I did not lose anything. Why am I feeling sad? That one is just because of the biological factor, that neurotransmitter in the brain has reduced. Then we also have stress. Stress can trigger depression or any mental illness. Not just only stress, trauma.
Yes.
Maybe the person has gone through a traumatic
Yes.
experience.
Yes.
That can also trigger a mental illness. And also the use of substance. So that, especially those that are involved in, I won't mention substances here, but those things can also trigger mental illness or depression. So for some people, they've not gone through something, they've not experienced anything traumatic.
Yeah.
Maybe because of the neurotransmitters in the brain, the chemicals in the brain, the imbalance in the chemicals in the brain might cause the mental illness.
So how do those people now have to deal with that? Because I know there is therapy that people do when they have mental health disorders. So people that have the imbalance in the neurotransmitters, what happens with those? Do they use medication, or can they do talk therapy?
Okay, so part of this. So what is the function of this neurotransmitter, the serotonin? It makes you to feel good. So for some people, if it's not chronic, they might tell them to do certain activities to increase to increase the feeling to release more serotonin.
Yes.
And will make them to feel good. Maybe
Yes.
like exercising, communicating with people, doing things that make you feel happy deliberately. Yes, those things can actually activate the serotonins. However, if it's chronic depression, the person might have to use medication. And that's why I said the person needs to go for proper assessment with a psychologist or a therapist. Proper assessment needs to be done before you can be diagnosed of having a mental illness.
I love it. You know what I love the most of everything? Proper assessment needs to be done. And this is something that is very very challenging for us in this side of the world, because many of us don't believe in therapy and all those things. Meanwhile, we're dealing with real life mental health disorders every single day. So please don't forget, go for a proper assessment with a therapist or a psychologist. So I'm going to ask you now, how is addiction related to other mental health disorders?
I had a session with a group of patients yesterday on this particular topic. When we talk about mental health, when we talk about substance use disorder, there's what we call a comorbidity. So for some people, it's because they were experiencing a mental disorder. Maybe they're feeling down, they're depressed, or they're feeling anxious, and this went to self-medicate and they became addicted to those substances.
So true.
Then for some other people, it's because they started using substances that they triggered or they elicited that mental illness in themselves. So most times there's always a comorbidity between co-occurrence between mental illness and substance use disorder.
Fantastic. Because many times people don't even understand that it's actually related. They'll just say no. So that's why when people go in for treatments, like in the course of my work, you tell them that, listen, if you have a mental health disorder that is co-occurring with a substance use disorder, you are going to be treating both. And
Both,
sometimes you probably
simultaneously.
treat one before the other. However, they don't ever want to accept, no, it's just a substance use problem. Please, just help him stop smoking whatever it is they're smoking.
So the thing about a lot of so I'm not going to generalize, but in this climate, we have people living in denial.
Absolutely.
So you have a child that has evidence of psychosis. So psychosis is when the person is not thinking, is not acting right. There's a the way the person is thinking, the way the person is acting is not right. And the parents will say, "Oh no, let's take the person to church. I believe so much in God.
Oh yes,
I believe so much. My faith is, but there is a place of medicine.
I love it.
There's a place of medicine, there's a place of therapy, and there's a place of prayer. Now, when this happens, we see parents saying, "No, it's my enemies. They've gotten me. My enemy,
my village people."
It's not your village people. It's just the fact that the child is going through a mental disorder that needs quick intervention.
And this can happen to just anybody.
It can happen to anyone.
I love it.
Can happen to anyone. So it's important as parents, it's important as caregivers, it's important as individuals. If you have someone around you that is not acting right, let the person see a therapist, let the person go in for evaluation so that the right intervention will be given to the person. Now we have people, like you said, people who come in, they say, "Oh, it's just the drug abuse." The substance use disorder is co-occurring with other mental illness, most times anxiety, depression. For some people, it triggers the substance they're using triggers psychosis. So when you see them dancing and jumping into gutter and they say, "Oh, it's parain," that is psychosis.
Yes.
But the friends will be laughing. The friends, unfortunately,
don't even understand
that guy has gone into psychosis. Person has a mental disorder. That drug the person has taken has triggered a mental disorder.
So all those things that we just see on social
media,
we're
laughing, is actually psychosis.
Hey.
And it's so unfortunate that, a lot of people don't. So when I have this discussion with, especially the young ones, when I say, "This drug you're taking, did they tell you that X, Y, Z, these are going to be the effects on you?" They're like, "No, I just tried it out. I just
it made you feel good."
Unfortunately, they don't understand the side effects. When I defined addiction, I said it's a chronic relapsing brain disorder, meaning that, you might be fine today, and unfortunately you go and try the substance again, addiction starts again. So it keeps relapsing. So it's very important that you go for therapy. It's very important you go for rehabilitation. It's very important you go to the clinic and you are helped. And help is there. Now, for mental illness, so the difference between addiction and mental illness is that mental illness, once the person starts using medication, once the person starts going for therapy, the person becomes better. The person might not have a relapse if the person continues.
It's consistent.
Yeah, continues to do what he or she is meant to. You're consistent with your medication. You're using your medication at the right time, and you don't do things that will stress you and all that. Now, for the substance use, the moment the person tries that any other psychoactive substance again, there is a likelihood of the person relapsing and going back into addiction. So when people leave when they leave our rehabilitation center, one of the things we tell them is that you are not to use any other psychoactive substance, even as little as taking some cola drinks, some coffee, any psychoactive substance. You're not meant to take them because it will open it. So we have some medication, we have some drugs, we have some substances that we call gateway substance.
Yes.
The moment you start taking those ones,
It's like a floodgate has been
just
opened.
go straight back into the other ones.
And they don't ever understand. It now looks as if you're trying to stop them from having fun. So we have talked about that. So I'm going to now ask you a question because we've talked about how people use prayer and all of those things. Like I'm a person of faith, I understand, and prayer does marvelous stuff, But why do you think that society struggles to view addiction as a disability?
So, like I said, when I started, I said substance use, the use of the substance in the first place might be a moral failure. Right?
Yes.
Might be a moral failure. But the continual use, and might become an addiction, and it becomes a brain disorder.
Yeah.
Now, most people see substance use as a moral failure. It's the initial stage, like I said, why would you go and start now?
Yes.
So it begins as a moral failure.
Yes.
But addiction itself is a disease, just like someone having high blood pressure, someone having diabetes.
Fantastic.
Diabetes, high blood pressure is a result of maybe the way the person was living, his or her life, person was not sleeping well, person was not eating right, and became a disease. It's the same with addiction. So the initial use of the substance, yes, is a moral failure. However, the disease, the addiction, is a disease. Now, most people don't understand this. They just believe addiction is a moral failure. Why would you go back? You're not meant to do this. It's the brain, and that's why we tell. So when I work with patients, I let them to understand that there are certain things you're not meant to do. There are certain places you're not meant to go to.
Your triggers.
Identify. So you need to identify your internal triggers and your external triggers. The moment you can identify this, you should. So like the person I work with say, there are just two things you need to do: change your lifestyle and avoid your triggers.
Truly,
if you can change your lifestyle and avoid your triggers, you will have a successful recovery journey.
And it's a journey. This is what I keep saying to people, that it's a journey. So it's best not to even get in. That's why prevention is a very important topic that must be spoken about, because when you get in, how do you know? Some people say, no, if I start, I'll be okay, I will just have fun. It's just especially for people that just want to go for parties, just be like, it's just a social drug,
just to pop myself up,
yes,
prepare myself,
just dirty my eye a bit
before I start the party, and all that,
so that I can, because it's most times the stimulants that they use when they want to do stuff like that. And then before you know it, the person is full blown, and they're telling you that, but this is not how I thought it would turn out. Hey.
So when I have sessions with people, part of the things I tell them is that, how many people did you start using this substance with? How many of them are still using this substance till now?
True.
And they're like, true. That is true. That my friend that introduced me to is no more. I said, because a person does not have an addiction. Is not predisposed to having an addiction.
Fantastic.
But there's some people in your blood.
But how do people know this?
You won't know. That's just it. So part of the things you can do, part of the things you need to look at is
family history.
In your family, family history. So how many people in my family use drugs? Or how many people in my family have tried or using one or two stuff? I was having a conversation with somebody yesterday, and I said, this particular person, all his siblings use this particular drug. Whoa. And the person was like, but how come all the brothers are using it? I said, but in your own family too, all of you drink. So you might not know who is prone to becoming addicted to a substance, and that's why prevention is the major. You don't even start, because you don't know if you start, if you will be a victim of addiction.
Absolutely. This conversation is very, very deep. Very deep and very broad. So I'm so sure that we'll call you again. I'm so sure that we'll call you again, because we're going to be dealing with different aspects of addiction. We're talking mental health and addiction in the course of, the Thrive Conversations. So I'm going to ask that. I know you have a lot of programs that you do. when it comes to, parenting and teaching teenagers. I mean, I've been a speaker on many of the ones that you've done. I'd like for you to just let people know what you do and what you have planned for this year 2025.
Okay, so part of the things we do at the parenting support system is an organization where I'm the owner of the organization. Awesome. So we have different programs under the tag Smart Parenting.
Yeah.
So we have the Smart Parenting coaching program. It's a 12-week program that I run every quarter for parents. I work with them intensely. We work about knowing how to raise your children, how to instill the right values, how to parent your children the right way.
I need to come and sign up for that.
Being smart in parenting your children. Then we also have the Smart Parenting Child and Adolescent Mental Health organization, where we work with children and adolescents in terms of their mental health. Then every Easter, we run a program for teenagers and adolescents. It's called Self-Mastery for Adolescents.
Yeah.
So during the Easter holiday, we run that program where we work with teenagers and adolescents in building mastery of themselves, in terms of mastery over time, mastery over their emotion, mastery over their relationship. And we teach them how to set goals and how to be the perfect person for themselves.
Absolutely.
Then every summer we run another program. It's called Productivity Challenge, 10 Days Productivity Challenge, 10 Days Personal Development Challenge, where they learn things about themselves, where they build them. We equip them with skills in developing themselves, personal growth, personal development, setting goals for themselves and all that. And if you want to reach me, you can go to my Instagram page, Oluwatoyin Ogunkomi.
So it's just your full names
together, Oluwatoyin Ogunkomi, or you can go to my website, www.oluwatoyinogunkomi.com.
You just see her name on the bar, so you
then
can
I also have
through
books
from there.
For parents.
Yes, please.
And I have books for teenagers coming up this year. About 5 books for teenagers coming up this year.
Fantastic. We can't have enough books. Because we really need to put as many resources out there, because the honest truth is a lot of people are suffering from these things. They don't know where to look. They don't know what to do.
Yeah.
So this is one of the reasons that the Thrive Conversations came up, so that people can know that they can find help, and that these conversations need to be held because these conversations are real. And like they say, the statistics says 1 in 5 families is going to have a person who is suffering from a mental health disorder or a substance use disorder. So you realize that is a conversation that should be held. Thank you so very much for coming in today.
Thank you so much.
We look forward to our next conversation when you will hear much more from you, and will help remold the society for everyone to know that indeed it's important to have these conversations. There's no health without mental health. Thank you, sis.
Thank you so much for having me.
And we have a little gift from you, just to say thank you. Thank you for coming.
So much.
We're grateful to have you here, and it's from Imose Pillows, just to say thank you.
Thank you so much for having me. Thank you so much for giving me this gift.
Thank you.
And like I said, I love what you're doing. You're actually, the prevention message is the message we need to preach out there, especially when it comes to drug use and addiction.
Absolutely.
Thank you.
Thank you so very much. Thank you.